All right, my friends, so here we're back again with this USMLE Step 3 classes. So today we're going to review some things about the headaches. It's a very high yield topic in the USMLE, especially in the USMLE 3. So I'm Dr. Albrecht and let's start it. Okay, so we're going to review the four main types. Though these are the migraine, the cluster headache, temporal arteritis, and the pseudotumor cerebri. So we're going to review how to diagnose them, how to treat them, and which are the differences between them. So let's start with the first one. Oh, yes, just to remember, for this lecture, I'm using the International Headache Society classification of headaches. So the first one we're going to review is migraine. It's a very common type of headache. Usually pain in the lateral or unilateral in your head. And let's see some of the characteristics. First one is unilateral. It could be also bilateral, but mainly it's unilateral. The pain that you will feel when you have a migraine is a throbbing headache. And if you have this headache and you start to do some activities like walking or running, you will feel it worst. So that's also a characteristic, like worsening pain with activities. If we talk about the intensity of the migraine, the pain will be moderate to severe. So this is like these four, the first four I read are the main characteristics. You have to at least two of these to make the diagnosis of migraine. And then some of this pain, they're preceded by an aria. That's like if you see some flashing lights or even you can smell like unusual smells before having the pain. So if you feel this and you can know that like in 30 minutes you will have the pain. Also, when you have migraine, usually it's associated with nausea and vomiting. So if you read these characteristics in the exam, like unilateral pain, throbbing pain, it's worse with running or walking or any activity, and is associated with nausea and vomiting, for sure it's migraine. Also, like in the exam, like if you read that the mom or any relative, direct relative, have also migraine, it's also a clue because migraine it's related to family history, so that's a very important clue. And also, what triggers the pain, the headache, in this case a migraine, could be many things. For example, for some people, caffeine could start a migraine attack. Also, oral contraceptives, cheese, and also wine. And without any treatment, the pain could last for 2 to 3 hours. I was saying this, like 40% of migraines are bilateral, but 60% is unilateral. So if in the exam again they say that it's bilateral, you have to think that also there's migraine that it's bilateral. Don't think that's only unilateral. It's the most common, yes, but it's not the only presentation. Okay, so in the treatment you have two options. One, when you have the pain, like in this case, for example, you're in really pain, like feeling your head really bad. So you have two options. The abortive therapy. In this case, you can use sumatriptan or ergotamine. This is the dose for sumatriptan. Like usually they won't ask you about doses, but if you want to know more, and I'm sure you want to, these are the doses. And again, for ergotamine, these are the doses, 1 to 2 milligrams orally every hour. So this is one part. Like if you're having an attack, an acute attack, you have the pain and you want to cut it, you have to use sumatriptan or ergotamine. But what if you have the pain and it's more frequenting, like 4 times per month? You don't have only to use this abortive therapy. You have to use the prophylactic therapy. So again, let me see this again. If you have more than 4 attacks per month, you have to start prophylactic therapy. And again, what can you use here? Propranolol, some tricyclic antidepressants, or the SSRIs. Okay, so remember, abortive is for acute attack, and prophylactic if you have more than 4 attacks in 1 month. Okay, that's all about migraines, like the high-yield things that you can be asked. The next one is cluster headache. Let's see the characteristics. So in this case, is very, very painful. It's a severe headache. It's unilateral. Usually, it's around the eye. The pain could last from 15 to 3 hours if it's not treated. And you have to have at least one of the following features. It's, for example, if you're having the pain on the right side of your head, you need to have one of the following features in the same side, like lacrimation, if like tears coming out from your eye in the same side of the pain, nasal congestion, rhinorrhea, facial sweating, ptosis, miosis, eyelid edema. So for example, in the picture, if you're having the pain in this side, here's the headache, it's unilateral, it's really, really severe. In the eye of this side, you will have the lacrimation. In this side of the nose, you will have the nasal congestion. So this is like the most common characteristic. And also the most frequent presentation is in men. So this is also something you have to remember. Again, here you have two options, abortive and prophylactic. In this case, if you can see, it's the same drug that we use in the migraine, sumatriptan. But in this case, you have two additional options. It's oxygen, 100% pure oxygen, and steroids. So remember, cluster headache, only one side of your head, associated with lacrimation, rhinorrhea, you're going to use oxygen and steroids. And again, if you have like many attacks in 1 month, you can use a prophylactic. In this case, you can use calcium channel blockers, especially high dose verapamil, and this is the dose. So remember again, abortive, acute, prophylactic if you have like more frequent attacks. You can use calcium channel blockers. Okay, so far we have reviewed two types of headache, the migraine and the cluster, but we have more. The next one is a temporal arteritis, or also called giant cell arteritis. So in this diagram you can see kind of the temporal artery and also this arrow which is pointing the yaw. So you will see why is that. So what is a temporal arteritis? It's an inflammation of the temporal artery, usually related with some autoimmune response, abnormal autoimmune response. So it's presented with tenderness of the temporal area, which is this one here, and also the jaw claudication. It's like you get tired of chewing something. You cannot chew because you have pain, and you cannot do that. It's more frequent in people over 50 years old. Remember this one? Also, you can have vision disturbances. One of the main characteristics of this temporal arteritis is this, intermittent blindness. So, again, if you read in the question intermittent blindness, you for sure have to choose temporal arteritis. Also, some things associated with this kind of headache is proximal muscle pain, or also you can have weakness. For the diagnosis, you can see or you can find the sedimentation rate above, even could be over 100, could be over 50 or even over 100. How to make this diagnosis? The gold standard is temporal artery biopsy. And again, what's the treatment? It's high dose steroids. In this case, prednisone could be used 60 milligrams per day. So, okay, this is like an inflammation. What do you have to do for inflammation? Use steroids, Remember this one, intermittent blindness, and people over 50 years old, and this one, the jaw claudication. With these things, if you read this in a question, for sure it's temporal arteritis. And the last one is the pseudotumor cerebri, or also called idiopathic intracranial hypertension. It's like, I know it's a long name, but let's talk about that. So the usually patient will have, again, the headache. You will find increased intracranial pressure, and also you will find papilledema. Also, one of the main characteristics is this, the pulsatile tinnitus. It's a really severe headache. It's painful. Like we remember in the cluster headache, it's also a very severe headache. In this case, remember in the previous one, we said also visual disturbances, but it was intermittent blindness. In this case, you can have a double vision. So remember, this is something to differentiate with the previous one. If you make any images like a CT scan, you won't find any disturbances. It will be a normal CT scan. And how to treat this? Acetazolamide, you can use that. Also furosemide. And one of the main recommendations for this is weight loss. And why is that? Because the main patient, like the typical patient, will be an obese woman. And why I'm putting two? Because of this, so you can remember double vision. So remember, it's like a young women, obese women having this really severe pain, having double vision. What's the main common diagnosis? Pseudotumor cerebri or idiopathic intracranial hypertension. But what if you leave this pseudotumor cerebri and treat it? You can even go to complete blindness. Okay, so you have to treat it. Okay, so in this review we have talked about four main types of headache. As you can see, they have some things in common, some differences, so it's really ideal to know how to differentiate them, how to treat them, and how to diagnose them. And again, thanks for watching, especially for my friends in India, and they're always supporting me, writing me comments. So please, if you like the video, thumbs up, and please subscribe to my channel. Thank you very much.